Personal protective equipment refers to the protective clothing, helmets, goggles, or other garments or equipment designed to protect the wearer's body from injury or infection. The hazards addressed by protective equipment include physical, electrical, heat, chemicals, biohazards, and airborne particulate matter. Personal protective equipment should be selected based upon likelihood of contact with body fluids during procedures in the patient care area. This video will demonstrate the proper sequence for donning and doffing the personal protective equipment for the disease control. First step in donning protective equipment is a good hand hygiene. The second step of the procedure is donning the gown. Wear lab coats that fit properly. Lab coats are available in the variety of sizes. It should be fastened close to the collar to provide optimal protection. And lab coats should be worn fully, buttoned, or snapped with sleeves down. The third step is the selection of respiratory protection. One option might be a laboratory mask. It is used for droplet precautions and care of influenza patients. To apply this mask, gently crease the metal insert to create indentation for your nose, then cuff the elastic band around your ears. Spread the mask to cover your face from the bridge of your nose to below the chin. Finally, ensure the mask is snug and comfortable on your face. Respirator mask acts a small particle to prevent small particles from entering the airway to the person wearing them. A respirator should be fit tested annually in order to ensure good seal. The property size of the respirator should always be used. Place the respirator on your face and position the straps at the back of the head and at the base of the neck. The straps should be in connect with the skin of your neck. Press the mask along the edges to seal it into your skin. Finally, breathe deeply in and out, feeling for any areas where air may be escaping along the edges. The fourth step is the eye protection. Protective eyewear may be safety glasses or laboratory goggles. The final step in the procedure is the application of gloves. Ensure that the cuff of each glove covers the wrist. Remember to touch only the inside of the glove to prevent any potential contamination. The first step in the procedure to remove personal protective equipment is the doffing the gloves. Gloves are removed first because they are likely the dirtiest item and are contaminated on the external surfaces. Grasp the first glove on the external surface at the cuff and gently peel off. Hold the removed glove in the gloved hand, then slide a finger of the ungloved hand under the remaining glove, touching its clean side only, and gently peel the second glove off over the first glove. Discard the glove in the trash. All movements in doffing should be slowly intentional to prevent the aerosoling of any contaminant on the used equipment. The second step in this procedure is to remove your eye protection. The glasses or goggles are contaminated on the outside, so touch only the earpieces or elastic bands while removing. Then eye protection should be placed on the trash or be placed on a designated area for reprocessing. The third item to be removed is the gown. The most contaminated areas of the gown are front and sleeves. You should remove it slowly and place it on a hanger. The fourth is the removal of respiratory protection. It is removed last to prevent any transmission of contaminated particles to your respiratory tract while removing the other equipment. Touching the front of the mask or respirator should be minimized during removal. When mask or respirator has the elastic bands, remove the bottom one first and discard the mask in the proper trash. Finally, perform good hand hygiene immediately after removing all of your personal protective equipment.